This is part 3 of the lecture on the evaluation and identification of children with suspected disabilities. My name is Dr. George Giuliani from Hofstra University, and we left off last lecture finishing up parental consent. So after you get the consent, after the parent consents to do the evaluation of the child for the suspected disability, we've got 60 days to get it done. And there are certain standards that need to be met when we do the evaluation of a child for a suspected disability. And under our federal law of IDEA, these 6 standards must be met in order for an evaluation of a child for a suspected disability to occur. And what we're going to talk about now are the 6 evaluation standards that have to be met under the federal guidelines. Standard number 1 is as follows. When considering eligibility for special education, the evaluation has to be done by a multidisciplinary team. Okay, so when we do the evaluation of a child for suspected disability, when we're considering the eligibility of this child, the evaluation has to be done by a team, and that is known as a multidisciplinary team. And a multidisciplinary team, or the MDT, performs the evaluation of the child for a suspected disability, and then will make a recommendation to the eligibility committee as to the child's eligibility for special ed services. In the state of New York, that eligibility committee is called the Committee on Special Education. In other states, it might be called something different. But the bottom line here is that a multidisciplinary team performs the evaluation of the child and then will make a recommendation for the child's eligibility. So what our law is saying, what evaluation standard number 1 is saying, is that many different players have to be involved. Many different people are going to be involved when doing the evaluation of a child for suspected disability. No one person is going to do the entire evaluation, and no one person is going to make the recommendation. So the multidisciplinary team is going to use a variety of assessment tools and a variety of strategies to gather relevant functional and developmental information, including information provided by the parent that will assist in determining whether or not the child has a disability as defined under the federal law. So our multidisciplinary team is going to use a lot of different tools and strategies. And we'll talk about that later when we get to evaluation standard number 5. What we need to look at is who is on the multidisciplinary team. Who is going to be a part of the team doing the evaluation of the child for a suspected disability. And the members of the multidisciplinary team are as follows. You've got a general education teacher or the general ed teacher of the child. You've got a school psychologist. You've got an educational evaluator, the person who will evaluate the academic achievement of the child, who can often be a special ed teacher, who's next, a speech and language pathologist, medical personnel when appropriate, a social worker, a school guidance counselor or school counselor, the parents, school nurse, and an occupational and or physical therapist when appropriate. So the multidisciplinary team has many different potential players on it. But the idea behind our federal law is that many different people need to be a part of the assessment process. No one person is going to do the evaluation. A multidisciplinary team must do it. Now, notice, by the way, under our list of players on the multidisciplinary team, that the parents are a mandated member of the multidisciplinary team. Under the law, there's always been a general requirement for parental consent and notice. But only recently have parents been mandated to be a part of the multidisciplinary team. So parents are going to be a part of this multidisciplinary team that reviews the existing evaluation data for both the initial and subsequent reevaluations of a child. So our first standard under IDEA, our first standard to recognize, is that the evaluation of a child for a suspected disability has to be done by a multidisciplinary team. In a sense, many different players are going to be involved in the process of evaluating this child for a suspected disability. Evaluation standard number 2 is pretty straightforward, and that is all testing materials and all procedures used for the purposes of evaluation and placement of children with disabilities must be selected and administered so not to be racially or culturally discriminatory. So the idea here is that when we're selecting as a district the tests to be used when we evaluate a child, we have to be able to show that the tests that are being used are not racially discriminatory nor culturally discriminatory. Now, if you know anything about testing, you'll know that all tests have some racial or cultural bias to them. It's just the way tests are. However, some tests are much better than other tests, and it's the responsibility of the school district to make sure that they pick out tests that are not racially or culturally discriminatory. And of course, we have to make sure that our evaluators, the people doing the evaluation, are also not acting with any racial or cultural discrimination towards a child. Evaluation standard number 3 says that all tests and other evaluation materials have been validated for the specific purpose for which they are used. Again, in order for a test to be good, it must have both validity and reliability. Validity and reliability. Now, validity addresses the question of, does the test measure what it's supposed to measure? Is the test measuring what it is supposed to be measuring? So if we give the child an IQ test, is the assessment actually measuring IQ? If it is, it has high validity. If it doesn't assess IQ, then it doesn't. If I give a child a reading comprehension test, does it really assess reading comprehension? If it does, then we know it has validity. If it doesn't, then it lacks validity. The other concept here is reliability, and reliability refers to consistency of results. We want to make sure that every time we administer this test, that we get consistent results. So as if I administer an IQ test to a child on Monday, and that child gets an IQ score of 100, if I give that same IQ test to the child on Tuesday with the same conditions, and the child hasn't had any practice time or anything, we should then assume that the child will get a score around 100. That's the way it works. So what do we need? We need validity, making sure that a test measures what it's supposed to measure, and we need reliability so that we're getting consistency of results. And in order for a test to be useful, it must have both validity and reliability. So standard number 3 says that all tests and all evaluation materials have been validated for the specific purpose for which they are used. And again, under this concept, the tests that we administer must be both valid and reliable. This ends part 3 of the lecture on the evaluation of children with suspected disabilities. You can now go on to part 4.